If you are a herbalist, nutritionist, or holistic practitioner of any kind, I hope you've taken a few minutes to watch the video I posted a couple of weeks ago, the one called Cardiovascular Symptoms You Need to Know. As holistic practitioners, we need to recognize what the major critical cardiovascular symptoms are. I know I've got some clients that are really anti-mainstream medicine, and they want to come to me for all kinds of problems, including things that really don't belong in my kind of a clinic. So these are the clients that if they run into a cardiovascular problem, as in are having a heart attack and don't recognize it, and they come to me because they feel like they've got a flu or they don't know what to do about this shoulder pain they've got, I'm the one who's going to have to push them out the door or drive them myself to the emergency room. As holistic practitioners, we need to be aware of what these critical cardiovascular symptoms are so that we can make sure our clients get the best care in a crisis situation that we can possibly help them get. My name is Judith Cobb. I'm a master herbalist, certified comprehensive iridology instructor, and natural nutrition clinical practitioner. I've been in practice since 1981. You do the math. In today's short video, we are going to recap some of the most important circulatory markers, just a couple of them, and we're going to start with the circulatory ring. The circulatory ring can show up in all eye types. We see it in hematogenic, lymphatic, and biliary eyes. We're going to look at several of them now. The circulatory ring is this blue haze that is hanging off the edge of the iris. Sometimes it's mauve or blue, one or the other, but it's hanging off the edge. This is an inherited marker. It suggests a strong predisposition towards inefficient circulation. Consider the circulatory inefficiencies of someone whose lips are turning blue and whose fingernails are turning blue. When we see things turning blue, we know there's a lack of oxygen. And it's approximately the same thing when we see it in an iris like this. This ring suggests that circulation may be compromised. And if circulation is compromised, then it's a safe bet that oxygen delivery and nutrient delivery are also compromised. Again, this is an inherited marking. Now let's do a little what if. What if we had a grandparent who had poor circulation and had the circulatory ring? This grandparent doesn't do anything to protect their health or improve their health, and they pass this same marking down to the parent. The parent doesn't want the same health issues the grandparent had, so this parent takes action. And before this parent has any children, this parent decides to clean up the diet, get active, take the right kinds of supplements. Then when this parent has a child, this parent is likely passing on a weaker version of this genetic tendency with the increased chance that the child will have fewer symptoms as long as the child continues to build on the positive changes the parent has made. Here's another circulatory ring in a lymphatic iris. Here we have a circulatory ring in an hematogenic iris. Now note that the circulatory ring doesn't have to go all the way around the iris. The next marker we are going to look at is the lipemic diathesis. The lipemic diathesis is really a liver indicator that has vascular repercussions. This white milky film that is creeping in over that edge of the iris is the lipemic diathesis. The lipemic diathesis suggests that the liver is being inefficient in its ability to process fats, and because of that, the blood fats are becoming disordered. The lipemic diathesis can go all the way around the iris, as it does in this image, or it may only be partial. Because the lipemic diathesis suggests that the liver may be inefficient in how it processes fats, and that can end up creating disordered blood fats. That can result in the fats plaquing in the arteries. When we see lipemic diathesis in an eye, we need to be asking questions about circulatory health. So in this eye, we can see very clearly that the white band that is forming is partial. It's at the top, it's at the bottom, but it is not affecting the sides of the iris yet. Because the lipemic diathesis builds over time, it's important as iridologists for us to be monitoring our clients' eyes at least annually. If we see a lipemic diathesis beginning to build in someone who is under the age of 40 years, we know we need to take action. That is a serious indicator that this person's blood fats are probably on their way to becoming disordered if they're not already disordered, and that this person is going to have a much higher risk of setting up plaque or building atherosclerosis. And so we don't want that to happen, because that of course increases the risk of heart attack and stroke. So when we see signs like this in a person under the age of 40, we need to clean up the diet, get them on the right supplements, do all those kinds of good things. If we see this beginning to develop in someone who's between 40 and 60 years of age, we are going to still address it, but we're not necessarily going to be quite as concerned, primarily because it could be natural aging of the cornea. If we see this starting to develop after the age of 60, again, we're going to be even less concerned, because this probably has some element of aging of the cornea, but it also may have a certain element of disordered blood fats. I've recently been working with a couple of senior citizens who have a lipemic diathesis. As we talked about changing their diets, both of these people are in their mid-70s. They both said, "Why would I? I enjoy my life. I'm getting older. I'm not going to worry about it. I'm just going to continue enjoying my life." Fair enough. The eyes don't give us a diagnosis. When we see lipemic diathesis in someone's iris, we cannot say you have atherosclerosis. We cannot say you have elevated cholesterol. What we can say is the sign indicates a greater risk of those things. Now, because we can't diagnose, we also can't prescribe. So we're not going to say you have atherosclerosis, therefore we are going to do these supplements to get rid of it. What we can say is your eyes suggest you are at a greater risk for blocking arteries. Here are the things we would normally do to prevent things from getting worse and to potentially reverse the situation. I hope you'll join me for a live webinar in a few days, where we are going to do a couple of circulatory iris assessments from beginning to end. We'll look at all of the circulatory markers and all of the markers that could affect the circulatory system in a couple of sets of eyes. We'll also look at what questions do those markers want us to ask, and what are some potential recommendations we would like to make for these clients. The registration link is in the description beneath this video. Thanks for watching.